Thank you, everyone, for joining our webinar today. The title of the webinar is Creating a New Baseline Standard for Practice Management System Vendors, Tips from the Field on Achieving Competitive Advantage and Stakeholder Trust. The moderator today is Lee Barrett, the Executive Director of EHNAC, and I'll turn it over to him now. Lee?
Thank you, Ron, and welcome everyone to our webinar. As Ron said, what we're going to be going over is really the specific areas on our practice management system accreditation program and a number of specific areas that will hopefully help you if you're looking to go through the accreditation program, and whether or not you're a provider, whether or not you're a vendor, whether or not you're a payer. Hopefully you'll find from the panel you'll be getting a variety of different perspectives from all of them who have been involved in the development of this program over the past year. So let me start by introducing our panel today. Leanne Cardwell, Senior Vice President of External Affairs for WEDI. Buddy Claiborne, who's President and CEO of Healthpac Computer Systems. Anna Croxton, Senior Vice President of NextGen Healthcare. Tim McMullen, Executive Director of the Healthcare Administration Technology Association, which is the group that represents all of the practice management system vendors. Ron Moser, Senior Auditor for EHNAC. Serene Monroe from GE Healthcare. Stanley Nachimson, who's the Principal at Nachimson Advisors. And Robert Tennant, who is the Senior Policy Advisor for the Medical Group Management Association, representing all of the group practices. So this is our panel today. And our format is going to be such that what we're going to do is I'm going to turn this over to Ron Moser after I have provided some context on the webinar that we're going to be going through this afternoon. Ron is going to take you through the development process for the Practice Management System Accreditation Program, including from his perspective some tips for you as a site reviewer and auditor for EHNAC that you can be thinking about and planning for if you're thinking about going through the accreditation as a vendor. For the providers, for those of you who are providers, again, one of the things that we think is going to be very important here, as we've had from MGMA, the AMA, and a number of the practice organizations and associations that have been involved in development, is really, we think that what you're going to want to do is to be asking your practice management system vendor if, in fact, they are accredited, or if they're not, are they going to be going through that accreditation? Because as Ron is going to go over with you, there are areas in this accreditation that we think are extremely important to you. One is not only privacy, security, and confidentiality, and being able to assure stakeholder trust with the patients that are communicating with you in a variety of ways, electronically, perhaps even through some type of portal you may have, but as well aspects of whether or not they've got a plan and they're executing against a plan for ICD-10 compliance as well in October of 2015. Next slide, Ron. So let me take you through for a minute the objectives that we're going to go through here. Well, we want to talk about the entire practice management process, the value proposition that we have put together here for not only the practice management system vendors, but as well as the providers, and for the payers and other stakeholders as well. What you need to be thinking about in going through the accreditation program if you're looking to make application, and some of the key areas that are going to be reviewed as part of that accreditation process, as well as each one of the panelists are going to be talking about when we get into the Q&A, specific tips that you can be taking back and be thinking about as you're looking to make application in the process. And really the other piece of this, which we feel is extremely important, is providing stakeholder trust and confidence. One of the things that is very important as we start to look at security, privacy, and confidentiality and stakeholder trust is the fact of trying to mitigate risk of a breach or incident of a health record, electronic medical record or patient health record. And the key there is the fact that what we have found in 2014, there were a total of 8 million incidents of a breach of records, of health records. This year alone in 2015, through April of 2015, there were over 100 million breaches of health records. So that just puts into perspective the magnitude, the breadth of this, and why we see it as being very important to have this as a major component of our accreditation program. Next slide, Ron. So the agenda, as I've gone through, is I've been providing some of the context to you on the program, why we've developed it, what we're doing, and we've spent the past year in developing it. Ron's going to go through in more detail about it. He's also going to provide a perspective then on some of the tips that he's found as being a site reviewer and auditor that we think will be helpful to you. Then we'll go into the Q&A, and I have a number of questions for the panel, but we are absolutely, this webinar is all about answering your questions. So we want you to be thinking about and certainly submitting your questions as we go through the webinar. Please do so by typing them in, and we will be addressing your questions in priority before even I start asking any of the other questions that I've prepared for the panel. So that is really our webinar and our format. And so we will now go into the next slide, Ron. What I want to talk about is the fact that it really goes back to some of the history on how we started this program. This is a joint program in collaboration that EHNAC developed along with WEDI. And Devin Jopp, who is President and CEO, and in Devin's place on the webinar is Leanne Cardwell, who's going to be talking about WEDI's perspective on how they were involved and the importance that they saw with this. We obviously worked with a number of the organizations that represent the providers, MGMA, and a number of others who, as representatives of providers, major provider group practices, as well as individual providers and physicians, the concern it was about, as providers have practice management systems really running their entire practice, including EHRs that many of the practice management systems have evolved into, what was to be in position that, one, there was a level of third-party review to determine stakeholder trust, especially around the security, privacy, confidentiality aspects. We also look at technical performance. We look at best practices that organizations are using and the resources that that organization, that practice management system vendor has and brings to bear to support the services and the products that they're providing. And we're also focused as well on ICD-10 planning to assure that the practice management system vendors have the appropriate plans and that they're executing against testing scenarios, et cetera, such that they will be in position to support all of your practices as well. So with that, let's go to the next slide, Ron. Let me turn it over to you to take us through kind of the overall development process as we develop the practice management system accreditation program.
Great, thank you, Lee. I appreciate that. I'm going to first talk a little bit about the process of putting this criteria together. We had three different really groups of people, or three different groups that we created in putting the program together. As many of you probably know, EHNAC has a pretty large number of programs addressing different entities within the healthcare marketplace, and we drew off of some of the core criteria we have in other programs, and then we, of course, needed some very specific expertise with respect to practice management systems in building this program out. And so we're really glad to have a great advisory committee that was together, and they provided oversight. and they provided further feedback for our work, and we met twice per month. And then we also had a work group which was kind of a breakout from the advisory committee, a specific work group that focused on developing new criteria, modifying existing EHNAC baseline criteria, and developing instructional guidance, which is additional guidance that sits behind the criteria so that whenever someone goes through accreditation and when they're applying for accreditation and filling out their self-assessments, they have additional instructional guidance that helps them understand the criteria better and gives some guidance on what we're looking for. And that group met weekly. And this occurred over a series of several months in putting all of this together. We also had our beta candidates, which provided feedback as they actually went through the process of completing their self-assessments for the initial beta program. And this was very helpful to us in getting information directly from practice management system vendors so that we could better finalize the package as it went out to version 1.0 to make it even more understandable to those who would be ultimately going to our final package. And that group met weekly as well. Lee, I don't know if you had any other comments on this slide.
No, I think that's I think what you went through is very good, Ron. I think the three, just to give you some further context, the three beta organizations that participated are also on the panel was GE, NextGen, and Healthpac Computer Systems. So those three practice management system vendors worked with us very closely on the development and provided some excellent input and feedback into the process as they worked not only as part of the betas, but as far as our advisory committee that we had. And so it was a very collaborative process, and it took really close to a year to develop the program, getting a lot of the information and feedback and reviewing all of it with the advisory committee and the beta organizations itself. So it's a very lengthy process, and it's also very transparent. The other thing that we do as EHNAC is a federally recognized standards development organization, we also provide a 60-day public comment period for the industry to provide comments. So we did that as part of the review, and we also, any one of these programs goes through ongoing enhancements. So every year we also have a process in which we're looking for identifying any other requirements, business requirements, if there's new legislation that has come out, that we will look to incorporate and enhance those programs. So it's an ongoing process, and it's a very collaborative process that we've put in place here to develop the programs. I think those are the additional comments I have, Ron.
Great, thank you, Lee. So we thought we'd have a slide that kind of shows you what our advisory committee was made up of. You can see there were a lot of industries that participated, the AAPC, the AMA, of course EHNAC, HATA, HIMSS, MGMA, and of course WEDI, who we partnered with in EHNAC, and WEDI partnered in putting this program together. Some of the other people who were on the advisory committee came from organizations such as Advanced MD, GE Healthcare, Healthpac Computer Systems, Humana, MedInformatics, NextGen Healthcare, Optum, and Practice Fusion. So we had a very excellent group of people from across the practice management system industry, from small to large practice management systems and across the various industry associations. The target of accreditation, I think, is significant to discuss. EHNAC has typically addressed organizations like our original programs focused on healthcare networks, and we work with HIEs and ACOs and all kinds of more organizational-based networks providing services that we build criteria for. However, this program is focused on a product. It's focused on the products of organizations, those products being, of course, the practice management systems. But even though the main focus is the product, we do still look at the organization as a whole, because we believe there are still organizational things that are very significant, especially with respect to how the PHI is managed and kept secure, and what the privacy policies are and privacy practices are that are in place within the organization. So since the organization provides support for its products and talks to customers in healthcare, and they could have periodic access to PHI, and also they could have periodic access to PHI as they're testing their products or getting test data to put through their products, and again supporting their customers, they are expected to have appropriate HIPAA controls in place. And we look across HIPAA policies and procedures and training programs and employee requirements. We also look across various IT policies and procedures. The program addresses basically two types of practice management systems. We kind of grouped it into these two types. One is the first one probably addresses most practice management systems, and that is those who provide both a hosted service and a service that might be installed at a customer site. But we also provided provision for any software vendors that might exclusively provide software installed at a customer site where they do not provide the hosted-based service. So we address both of these types of organizations. Some of the key areas of focus within our criteria, again, I touched on the fact that we have some core criteria that really goes across all of our programs. We have core HIPAA, privacy and security criteria, including the additions from HITECH and Omnibus, the finalization of the rule, and we go pretty deeply into detail on specific requirements around these. And we include things such as breach notification and risk assessments of breaches, and pretty much from top to bottom HIPAA. Then we also have environmental, technical performance, business practices, and physical and human resource requirements. And these focus in on things such as customer satisfaction, truth in advertising, assuring that you have the physical capabilities in terms of your data centers, in terms of your corporate site to be able to grow as your company grows, to be able to house those resources needed to support your customers, and also that your systems are able to demonstrate appropriate capacity and capabilities. We also look at things such as making sure you don't have single points of failure with your people, that you have cross-training in place, and of course that you have regular HIPAA-related training. Other aspects of the criteria include transaction and coding standards, and that's where we get more specifically into, with practice management systems, the type of X12, 5010 transactions that need to be supported. We look at the software development lifecycle, and we look at specific things that we expect to have formalized with respect to how you deliver your products and how you assure quality and how you can demonstrate you do sufficient testing and that you can back out releases if there's issues, et cetera, et cetera. We look at providing your software requirements that you formalize the way you do your development, and then full revenue cycle management for your customers, again, spreading across the various transactions you support and how you provide quality services through your product to your customers. So EHNAC's criteria development process flows like this. Whenever we have a new program that we are putting into place, we have a criteria committee that recommends the new and modified criteria, and this is once we have a draft set of criteria that's been put together with a group such as our practice management advisory committee. So that information goes to the criteria committee. They finalize it and recommend it to the commission. The commission approves, rejects, or sends it back to the criteria committee. And once it's to a point where the commission approves it, we release it for public comment with a press release, and we put it out there for 60 days so that there's time to get additional comments from the public. And then we take the additional information that we get from the public and we finalize the criteria. If there's any substantive changes, we have to go back and actually do some major changes and do another public release. But usually through the public comment period, we're able to do some further tweaks and finalize the criteria. and then we present that again to the criteria committee, and then to the commission, the EHNAC commission, and the executive committee recommends any final revisions, and then it's sent to a formal release, a version 1.0 release. In terms of how companies, candidates, apply for accreditation, there's a pre-application process where entity fills this out online, and they can just go to our website, fill out a pre-application, and that helps EHNAC qualify them to make sure that the program they're wanting to apply for truly fits the nature of their business. Once they're approved for that, a formal application is completed, and that involves some more documentation and also the fees that are associated with the program. Once their application is accepted, they're sent a self-assessment package that they have to fill out, and this is where the bulk of the work is done, because responses have to be provided for every criteria, and also samples of evidence need to be provided within the package that are linked to, so that a very full package is then zipped together and submitted through EHNAC's secure portal for EHNAC to review. A site reviewer early on is assigned to each applicant, and they then review the self-assessment package. If they have any initial questions, they follow up with the candidate, and then they do an on-site review where they evaluate the physical locations where PHI is handled, and they conduct interviews with staff to make sure that all of their questions are answered, and then they complete the final report, which goes to the EHNAC commission, and the final award is given. And that would be either full accreditation, provisional accreditation, interim, or failed. Provisional would be if there's a substantial issue that needs to be taken care of. A company will be given a period of time in which to correct that. Interim typically refers to a company that's been acquired by another, or if a accredited company acquires another, they're put into an interim period where that new entity has to also be accredited. If a candidate fails accreditation, they can either reapply or perhaps even find another program that would fit them more appropriately. I'm going to take a real quick pause here, and Lee asked if you'd like to go over this pricing model at all.
So the pricing model that EHNAC uses for organizations is really based on revenue tier, and it goes from very small to very large. So it goes from $3 million to greater than $75 million, and for an organization that's less than $3 million, the annual fee is $2,750, and a site visit fee per site is $3,750. So if an organization has only one site that needs to be reviewed, along with the annual fee, it is less than $8,000, and the level of the review is very, very detailed, very comprehensive. So, which includes things like performing risk analysis. We want organizations to perform annual risk analysis, and to go through really and start to have all the appropriate documentation in place. I think I'm going to turn this back to Ron in a second, but I wanted Ron to as well talk for a couple of minutes to you, for all the vendors in the audience here, on what you would need to do. Some of the tips that he has as a site reviewer and auditor to keep in mind as you're looking to make application. And then, as I indicated, once we go into the Q&A, I want Buddy Claiborne, as well as Anna Croxton and Serene Monroe from the 3 Beta organizations, to talk to you as well about their specific experiences and what they have found as far as the value proposition. So the pricing model, all of our information, as Ron indicated, is online. This is a very transparent process. We also have, if you wanted to see, hey, what does this criteria really look like, you can download it from our website at EHNAC.org and take a look at it, and you'll see exactly all of the criteria that's involved and that we're talking through, so that you can, in fact, it'll help you in the preparation as well to go through the process. So Ron, let me turn it back to you to talk through kind of for a few minutes some of your thoughts. I know you're going to be going into some of the aspects on lessons learned and some thoughts that you have on for organizations to be considering.
Yes, thank you, Lee. Appreciate that. First, I'll kind of go over my lessons learned here, and then I do want to talk about some preparation sort of things that you might want to be considering. Some of the things we learned as in going through this process, one organization may offer multiple products, and we keep that in mind as we do the review. We want to make sure that we are encompassing whatever the organization provides in terms of practice management systems, and part of the whole process is to scope out what's included within the review. Again, we look at the organization as a whole and how healthcare data is managed, and then specifically we look at whatever practice management system products are in place. Since each product has multiple versions, the SDLC process is very important. I'm sorry, I'm having some trouble with my screen here. Hopefully you can see it okay. The SDLC process is very important, the system development lifecycle. We want to see, as I mentioned before, that the process is well managed and that it's formalized. We do scale things based on the size of an organization. We know that a company with 10 people isn't going to have the same level of formality and documentation as a company with 10,000 people. So we do keep that in mind. We still want to see that there's formalization in place and that you're set to be able to grow. Some of the complexities that we've seen include VARs or white labeling, where there's another company that takes the product, the practice management system vendor has developed and then resells it. And the key we're looking at is that there are assurances that they aren't doing anything that would bring it out of compliance with EHNAC. And then we do also recognize practice management systems very spelled incorrectly on this slide, V-A-R-Y. They vary significantly, and that's one of the reasons we gathered industry-wide input in putting the criteria together so that we can make sure that any criteria that are designated mandatory, which means you absolutely have to meet them, they should pertain to everyone, that any reasonable practice management system should have such things in place. Some other things I wanted to just talk to briefly are, if you're considering going through this program, some things that you should do kind of in preparation. As I'm sure you've gathered from what we've already discussed, you should have your HIPAA house in order. You should have policies and procedures in place and a training program in place that really address the various aspects of the regulations. It used to be that we'd have to kind of talk differently if you're a covered entity versus a business associate, but now with the final ruling through Omnibus, it's really not a lot different. Everyone pretty much needs to be in compliance with all of it. There may well be some privacy-related things that don't pertain to you, but you should still be able to articulate that and why they don't apply to you. But you should have a full set of privacy and security policies and procedures. You should have training in place to make sure your people are going through at least annual training. And when people are brought on board, they should be trained before they come in contact with PHI. You should also be looking at your IT environment and formalizing that as much as possible. We do look for formalized policies and procedures to demonstrate that you take, again, the controls around your IT environment seriously. And one of the nice things about EHNAC is you can go out and download the PMSAP program, and you can see what the criteria look like. So you have great opportunity for preparing yourselves very well before you actually even apply. another very key thing in going after EHNAC accreditation, I'd say first of all, it's making sure you have executive support within your organization and that you have a project manager assigned who is very good at being focused and on being able to get results from the various people who need to contribute to putting the package together. So with that, Lee, a pretty quick summary of some of the key aspects of what an organization needs to do. I will pass it back to you.
Thank you, Ron. Thanks for the overview and some of the tips that you've provided. So let me mention again is as we're going through the webinar here and some of the questions and some of the comments that you're going to be hearing, if you have questions, please type them in and we will be sure to get to your questions as we go through the webinar. So first, I'm going to turn to the panel now. Rob Tennant, are you there? Okay, maybe Rob is not. I know Rob is traveling. Oh, there's Rob.
Sorry about that. I was on mute.
There you go. So Rob, from MGMA's perspective, first of all, thanks very much for participating. I know you're en route to another location, but appreciated your being able to make the time. So from an MGMA perspective, you've been involved in the development on the advisory committee for the development of this program for the past year. You know, what are some of the challenges and opportunities for medical groups in the current e-health environment that MGMA is seeing and that kind of you're seeing?
Well, thanks, Lee. And I wanted to start really at a high level. First of all, I wanted to thank EHNAC and WEDI in particular for taking on this task. You know, you heard a lot of the background, but even going back further, we worked directly with the American Medical Association for years to develop some tools and resources to help our member practices select the right practice management software to meet their needs. And we developed a guide, but we realized that the next step was certification or accreditation. And we frankly looked at a number of organizations that could step up and take on this role, but it was EHNAC and WEDI who agreed to accredit these software programs. And I can't tell you how important it is from a practice management perspective. I think we have worked diligently over the last 10 to 15 years to develop industry standards to allow the electronic transmission of administrative data. But if practices can't take advantage of those standards, and of course they've been augmented recently through the Affordable Care Act and operating rules, and if practices can't take advantage of those standards, we'll never reach the type of efficiency that we at MGMA and others believe we must get to. So the accreditation program will allow practices to really leverage these administrative standards, but at the same time, and you've heard a lot about the HIPAA security and privacy components of the accreditation, that's become an even more critical issue over the last few years. Obviously, security is a component of meaningful use. There are now numerous government agencies involved in audits. All of them are requiring that practices conduct risk analyses and address issues of security. And also, I think the other major component which Lee touched on was ICD-10. Arguably the biggest challenge facing practices since Lyndon Johnson signed into law the Medicare program in the 60s. If the software vendors cannot support ICD-10, practices run the risk of significant cash flow disruption. So I think those components combined, frankly, make this accreditation program absolutely invaluable.
That's great. Rob. So let me ask you another. Let me ask you another follow-up. Then I know MGMA has been very proactive in some of the outreach to your member organizations. So how, what are some of the specific kind of strategies that MGMA is taking to assist the medical groups and in kind of performing kind of the outreach, making them aware of the accreditation program and kind of the value proposition and why they should be looking to in fact make application to go through it?
Yeah, it's a great question, Lee. And I'll step backwards in time to the mid-2000s when the Certification Commission for Health Information Technology came out with its voluntary certification of electronic health record software. And I remember there was some industry pushback against that program, but MGMA got involved and very aggressively educated our members to the value of that program with EHRs. And I think we saw very quickly when you walk the halls of an MGMA annual conference, the exhibit hall, that a large number of vendors realized they had to step up and achieve certification. We expect the same thing here. We are very aggressively communicating the fact that this accreditation program through EHNAC and WEDI is available. We were thrilled that 3 major vendors stepped up and achieved accreditation. And I think what we're going to do is through articles, through online forums, through face-to-face conferences like the one I was just at, it's an opportunity for us to tell our members that there is a value proposition for them to ensure that the software program they select is accredited. We believe that it will be probably the first question that a member practice will ask a vendor. And it might be a situation where if the vendor is not accredited, then it's not on the short list for selection. Because we believe that there has to be some assurance when a practice is going to spend what can be tens of thousands, if not more, on these programs, that it meets a minimum level of both security, privacy, but also, again, supports these administrative standards, including ICD-10. So, again, this is an absolutely critical program if the industry is really to take advantage of these standards and also protect patient data, which has become, again, very, very important component of practice management.
Thanks, Rob. That's and first of all, we have absolutely appreciated the partnership with MGMA, the AMA, and a number of the provider membership organizations who have worked with us. And I think the perspective of having the providers involved in the development of this and making sure that we have those requirements built into this program as we developed it was absolutely critical. So we absolutely appreciate the input. I guess let me turn to Leanne at WEDI. So as I mentioned, WEDI has been a significant partner as we developed this program. And Leanne, I guess as WEDI partnered with EHNAC and we've been looking to launch this program into the industry. First of all, I guess question one is, why did WEDI want to partner with EHNAC? What did they see as far as kind of the value prop to the industry, for one? And then two, how is WEDI looking to work to promote the program as well to not only the practice management system vendors, but to the industry, the providers as well?
Sure, and thank you. So the driving force for WEDI to partner with EHNAC to develop this program is we believe that this initiative is essential. We saw a gap in the industry we want to ensure that practice management system vendors are accredited to allow everyone to be on a level playing field in functionality and privacy and security, as Rob mentioned. The accreditation program will assure current regulatory requirements are met, provide a proper framework for privacy and security for practice management system vendors, and really kind of level the playing field within the industry. Echoing a lot of what Rob just mentioned, we view our role as galvanizing the industry to take this on. We'll do that by promoting this for our members as a channel marketing strategy. We'll include it in our educational offerings, conferences, meetings, as well as our meetings and communications with regulators. We're encouraging the accreditation program. We're encouraging adoption of it, and especially the vendors to get in front of this now before their customers demand it, which we believe will absolutely happen. Adoption of the program now demonstrates that a company is being progressive. It will help these companies reach a common bar with their peers, help them understand what their customers need, and mitigate risk, again, from privacy and security breaches by ensuring the appropriate infrastructure is in place. Just want to add on that we are grateful for the partnership with EHNAC. Thank Rob for the comments, and look forward to continuing our work with you.
Thanks, Leanne. Excellent, and we've absolutely appreciated the partnership, and we continue to work with WEDI on a number of other initiatives that we're outlining together as far as issues in the healthcare industry that we may look to develop accreditation programs for. So we very much appreciate the partnership. So let me turn to Tim McMullen from the Healthcare Administrative Technology Association, which is really the industry action group for and representing many of the practice management system vendors. And Tim, I know again, HATA was very actively involved with us with the development as part of the advisory committee to develop this, and assuring that a number of your members were also involved along with HATA in collaborating with your members, getting feedback, etc. So how did, from HATA's perspective on how you've been developing not only the organization and continuing to expand the organization and getting a number of other practice management system vendors involved, what was HATA's driving force to be involved with the development of this this package and this accreditation program?
Well, thank you, Lee. It has been a wonderful relationship, and kudos goes out to you, Lee, and to WEDI for reaching out to us to want to have our input. The Healthcare Administrative Technology Association is the nationally recognized trade association that represents the practice management system industry, and we want to provide valuable resources to our members. And one of those resources is to provide the tools to expand and build upon a member's client base. So when we first discussed this, we saw a lot of ROI, and that was the driving force, I think, behind it. We saw that, that this is going to be a marketing differentiator. This is going to be the seal of approval for practice management systems. And for practice management systems, it's also going to be able to show their clients that they're compliant with the HIPAA standards. And not only their clients, but they're going to be able to track their business associates on their privacy and security requirements. They're going to be able to show their payer relations, that they have policies and procedures in place for privacy and security and operations and meeting HIPAA transactions. And with our experience with the other EHNAC accreditation programs, we knew this is going to eventually show up on RFIs and RFPs from the medical community wanting to see this EHNAC accreditation. And so I think based upon all of just the sheer return on investment that practice management systems are going to get out of this, that's what really got us excited to get involved. And you're going to hear from a couple of our members, and I'm sure they're going to chime in on how they're going to utilize their accreditation now to help them be that market differentiator. So that was, like I said, that was really the key for us getting involved, Lee.
That's terrific. Thanks, Tim. Very much appreciated. And look, as we get some of the feedback from the beta organizations that participated, clearly we want to get your continued input here as they're giving us some of their perspectives. So let me turn to really the three beta organizations that worked with us, Buddy Claiborne, Ina Croxton, and Serene Monroe, and ask for some of their thoughts. So Buddy, let me turn to you first and ask for your thoughts. Healthpac was involved with the beta organization, was also involved with the advisory committee. We went through a lot of work and effort as Healthpac to go through this. So perhaps you can share with the audience here the amount of resources that Healthpac allocated to this project, how you went about actually managing this from an organizational perspective, your thoughts on some of the costs, as well as kind of the value proposition. What was kind of the value proposition, and would you say to your fellow peers out in the audience here that this was really a worthwhile experience, and that you're looking to continue to not only show your existing provider organizations that you've taken this very seriously, but as well to continue to be involved with the development of the program. So I asked you like 3 different questions as part of that, but really want to know your thoughts and the experiences from Healthpac.
Well, thank you, Lee. I appreciate the opportunity to be here. We also thank you guys and WEDI and HATA for putting this webinar together. It's very important that we reach out to our peers out there and for the healthcare providers to stay abreast of what's happening and what they need to be aware of. For us at Healthpac personally, the real key for us was making sure we had the right project manager on this task. We knew that we had to be part of this. A good friend of mine and mentor, Richard Courier, from InterSystems, always advised me, you have to do something that's going to separate you from everyone else. And certainly going through the PMSAP accreditation process is the ticket for us right now. And that's going to separate us. Like the Bible says, separate the wheat from the tares. That's the goal that we have. But the project manager we selected was our Director of Technology, Brad Nagy, who really was the backbone and the inspiration and the guiding force to make sure we made it through this journey, because it was incredibly impressive to us, just the thoroughness that you guys have put together to lead someone through this journey of accreditation. Well planned, well documented, and well executed on your part. So kudos to you guys. So it was worth every dime we put into it so far, as far as an investment on our side. I'd like to turn it over really to Brad, let him talk about some of the specific things that were very important for us, and some things we had to change our own business model to help us improve every single day, which is our goal.
Thanks, buddy. So you asked a couple of questions there I wanted to sort of focus on and answer quickly for you. The first one was about the corporate resources that we put in place, and like Buddy said, I was the head, the legs, the arms, and the tail of the beast here at Healthpac. We, being smaller than some of the other beta testers, have a little bit different resource pool than most. So it basically was 3.5+ months of me and a very small crew on my side, basically a full-time proposition for us, and we put a lot of time and effort into it. A lot of that time and effort had to do with the fact that the number of changes that we may have had to make versus some of the other beta testers was probably significant. I know a lot of the others had most of these types of processes in place where I may have written upwards of 100+ pages of policy and procedure in this time period to modify, mold our current process and procedures into what they needed to be. So that was the question on the resources. The additional cost for us was not bad at all. We did have some penetration testing, some technical monitoring systems. We also made a few modifications to our internal procedures. One being training. We outsourced a lot of our training on PHI to an outsourced company, so we sort of moved some of that responsibility. But overall, the costs were fairly low, but the time was well worth it, in our opinion.
That's terrific, Brad. We really appreciate kind of the perspective on the time and the resource. You know, Brad, you know, with your background on the IT side, are there any specific areas that you would tell people, your peers out in the audience, that here are some things from a smaller organization that I think that you should be thinking about as well to prepare to go through the accreditation that you learned, kind of lessons learned?
Most of it has to do with allocating enough time and resource to the implementation of these processes. Documentation is fairly straightforward, obviously not a difficult task, but making sure that you have the appropriate systems in place, that you have the appropriate policies and procedures. I would say where we came into play is just making sure that you have enough time and people to put into it. That was really our most difficult spot, was even though it pushed me into a sort of different and more advanced role for that time period, the rest of me was still had to perform what was needed for the company. So those would be the primary things I would prepare for in doing this as a smaller company.
It's always a balance, Brad, isn't it?
It is. And I caught up on sleep the month after, so.
Well, that's terrific. That's good. No, I do think that some of the comments that you made are very good, because I think as the audience here, there are a number of practice management system vendors that may be smaller organizations that are saying, gee, you know, this is going to, you know, how much time is this really going to take, and what is the value prop really worthwhile? And I think, Buddy, I think the answer that I've heard from both you and Brad is that the answer is unequivocally yes. And I think the other aspect that I heard is really, you went through this and made the investment in this because you were looking for a competitive differentiator. And that was also a very important driver to Healthpac to be involved with this particular program. Is that fair?
That's absolutely correct. Definitely, we need something to help differentiate us from the bigger companies out there, and to show how sincere we are about this industry and where we're going, and to help ensure our survivability in the future as well.
That's good.
Believe me, we push this every time we do a presentation. We let them know up front and center we are fully accredited by EHNAC.
And that's exactly, I think, a key opportunity that organizations need to be aware of, is the ability to market that and to use it really as a competitive differentiator. So we thank Healthpac for your thoughts here, and hopefully you may have some other thoughts as we get turn to Serene Monroe and Anna Croxton, both NextGen and GE, certainly on the other side of the spectrum as far as larger practice management system vendors. And so I'd ask, you know, both, Anna, let me turn to you first. At NextGen, you've been very involved throughout the entire process with us. From a NextGen's perspective, what were some of the, you know, the amount of time, the resources, kind of lessons learned that NextGen came up with, as well as kind of the value proposal on why NextGen got involved with the beta, and how are you starting to see some of that value proposal that you were hoping to achieve actually come to fruition?
Well, first of all, let me say that the reason that we got involved was that, you know, many of us have been involved in programs that seem disconnected from the what looks like their main objective. So, you know, we wanted to make sure we wanted to be involved as a beta because we wanted to make sure that an accreditation program for practice management systems actually addressed industry concerns and risk. It didn't have that kind of disconnect. And then we wanted, we felt very strongly that providing evidence that we had gone through a good independent audit would provide assurances to our clients in many areas now that there's an increased awareness of risk in the areas of privacy, security, the mandated standards and the operating rules, and frankly, just industry standards that our clients know, or prospective clients know, that we meet them. I mean, ultimately, the intent is we hope it will provide a competitive advantage to say that you're an accredited product, and we look forward to the time, and I don't think we're quite there yet, when it becomes part of an RFI. I think that's sort of the end game on some of this. In terms of what it took, I will say I think the process went very well once we assigned a dedicated resource. You've heard that from Buddy. It is so important to assign that resource, and then once we did, it was very organized and logical. I mean, EHNAC was really great to work with, but I was under the delusion at the very beginning, thinking, oh, I'll just answer some questions and farm this, have people fill some of this stuff out, or show evidence of compliance. It was a little more involved than that. And sometimes the hardest thing was providing evidence of compliance, because actually, part of it is while you may have a process in place, you may not have documented, even with a larger organization. Maybe not as much as a smaller one, but we had circumstances where we found ourselves doing some writing as well. And again, I think that was all very healthy and very appropriate for the audit to take us through that, so that we basically have our ducks in a row. So I also think that the person assigned to do this needs to be given the authority and have the knowledge to handle the types of questions regarding internal processes and product functionality. They really have to be empowered to obtain the information and to provide it to EHNAC in the appropriate manner. But overall, we're very happy to have participated. We are also, showing at every opportunity that we're EHNAC accredited, and again, look forward to having that be the first question in the future.
Perfect. Thank you, Anna. Serene, what are your, from GE's perspective? GE had a number of people as well that were involved, and we went through this with GE, and obviously you have a number of people and resources that were focused on this. Want to give us your thoughts from GE's perspective on the process, going through the process, your involvement, why GE was involved, as well as the kind of the value prop that you're looking to see as well. I think Anna brought up a very good point. I think one of the things we're hoping that as the industry starts to become far more aware of the program, we've seen, and we have seen this, for example, on several of other programs with a number of payers that now have put in their RFPs and RFIs that organizations need to be EHNAC accredited to be able to apply or respond to RFIs, RFPs. I think that's, in fact, exactly where this could be heading as well. But let me turn back to Serene, GE's perspective.
Yeah, thank you. I think much of it's already been said, but from the GE perspective, with our customers and understanding their data and their concerns around privacy, HIPAA and data security is just top of mind anymore. I mean, every customer that you talk to is very concerned, that they're adequately serving their own customer base, that they've got systems in place that can prove that their security is really covered. And even though we've got a very robust quality management system at GE, having that third-party accreditation was really a logical step for us. The value of having somebody else come in as an independent auditor and look at what we're doing and make sure that we really are doing the utmost to have a system that meets the security standards and that our customers can be confident in. It was just the next logical thing, and working with your team to do this process was a really wonderful thing to do. It was very collaborative, you know, actually having us look through and address all of our policies and procedures and be sure that what we had in place was the right level of you know, the right level of policy protocol, that we really were doing the things that we should be doing and in the right ways. It was just a really great way to go through what we do and make sure that we're doing it right, and have such a collaborative team actually work with us to make sure that our accreditation really was something substantial. And so from our perspective, there's a huge amount of value just in the review of the processes that we have in place and having that stamp of approval from the independent party that what we do really does meet the privacy and security standards that our customers expect from a product like ours.
That's
so
great.
I think it was a great process. The other thing that I would mention, and it's been said a couple of times, but you really, you know, if you're going to go for this kind of accreditation, you really need to approach this as a project, and having the right team set up, that the right set of resources that are devoted to doing this, it's just critical to doing this.
I think that's all excellent advice. I think from each of you talking about having a project manager, I think I've heard that consistently from all three of you, that really is important, that somebody's dedicated to coordinating and putting together the team and coordinating with the team on the gathering of the policies, procedures, the controls, the appropriate documentation. That I think is important. I think I've also heard each of you looking at this from the standpoint of being able to demonstrate to the providers that you're looking to sell your particular systems into, and those that you already have your system into as well today, to provide that level of kind of third-party review and the level of and how seriously that each of your organizations looks at security, privacy, and confidentiality. The other thing I was going to mention to the audience is, as well, as you're looking at the criteria and the practice management system accreditation program and criteria that we put together, we have as well for all of our accreditation programs. Back in 2013, we spent a significant amount of time, really a good part of the year, aligning many of our criteria that we have for security, privacy, and confidentiality with that of the Office for Civil Rights and their audit protocol, so that organizations, if they were selected, as many of you know, OCR is really the federal enforcement agency, and for any breaches that are occurring of over 500 individuals, et cetera, they plus any complaints, they have specific responsibility for levying fines, et cetera. So we did spend our time in aligning all of our criteria with their audit protocol, so that if any of the organizations that were going through accreditation were in fact selected to be audited, that they would be in a good position to respond to any of the audit requests by OCR. We're also finding that the states, the attorney generals within each of the states, is taking a very proactive role as well. So we're finding that having a third-party review is critical, and organizations are looking for that objectivity of an organization or a product or service. Today, even more so because of the breaches that have been occurring in the industry, and the fact that organizations, we're finding in a lot of major organizations, at the board level, things like breaches and audits and other types of reviews and controls really weren't reaching at the board level or audit committees, whereas today, because of the magnitude of some of these, they have become even far more important. So all I can tell you is that we constantly are aligning our criteria and constantly monitoring what's going on at the federal level to make any enhancements to our programs ongoing. So some excellent feedback from Anna, as well as Serene and Buddy and Brad. Thank you very much. Let me turn to Stanley Nachimson. Stanley has been very involved as well through the entire on our advisory committee, and he has significant background, over 30 years at CMS, and has his own consulting group now, and really is involved with a number of organizations, and seeing really this what's happening at even a more global level. And Stanley, I guess a couple of questions that I've got for you is that as you look across the spectrum, we've got the ONC with their interoperability roadmap that they've laid out for the next 10 years. WEDI has as well laid out their roadmap. EHI has their roadmap. As we look at, you know, the practice management system vendors, the EHRs as well, basically organizations could be saying, well, doesn't what I currently have, the fact that we may not have any third party, isn't what I have okay already? Why do I need a third party review? And, you know, and why would, you know, from your perspective then, why would any of the vendors that we have, practice management vendors who are listening on this webinar, why should they be thinking about going through accreditation besides, you know, some of the things that we've heard from certainly the beta organizations that participated? Love to get your perspective on this.
Thanks, Lee, and thank you for having me on the broadcast, and welcome to our attendees. And I have to tell you, from my observations of quite a number of years of HIPAA implementations and other HIT implementations throughout the industry, what we have here is first a lot of I'll call it lack of knowledge or misunderstanding as to the requirements for a good practice management system. Whether it's from the provider side, where they seem to rely on the vendors to make sure that all of the functionality is there, or on the vendor side, who kind of depends on the providers to drive the demand for certain things. There's really a lack of knowledge. What the PMSAP provides is, I'd say, a win-win here. It enables vendors to understand all of the necessary and very helpful functions that a good practice management system provides, and it will enable a provider to take advantage of all of the new HIT requirements. And from a provider standpoint, it enables a provider to know if they have an accredited practice management system, that they've got the capability to take advantage of all of the present and upcoming administrative transactions. One thing that we've seen is that ONC and EHR accreditation focuses a lot on the clinical side. It has not focused on the administrative side. In fact, ONC in their interoperability roadmap specifically says that this version of the roadmap does not address administrative transactions. So there isn't anybody that's really, or up to now, there hasn't been anyone that's looked at the full range of capabilities for practice management systems and what a good practice management system looks like. So we now have a program in the PMSAP that, again, gives vendors the knowledge that they are fulfilling all of their customers' needs, and the customers knowing that any accredited system will have all the capabilities that are necessary. Very positive step forward.
That's great, Stanley. I guess, are there any specific thoughts that you might have besides, I think, some of the comments that you just made, which I think are very good, as far as looking at, you know, as we're talking to the vendors, the practice management system vendors in the audience, you know, what are some of the, I guess, benefits that an accreditation, the third-party accreditation may have to them? We've talked kind of about the competitive advantage, I think, as well, that organizations are looking for third-party review. Any other thoughts that you have on basically to the vendors as well as to the providers that may be listening in, as kind of the value prop and why they should be looking at a third-party organization, and what types of things they should be evaluating in determining one organization versus another?
Sure. I think from the vendor standpoint, there's not only the competitive advantage, but there's also the, I'll call it the regulatory assurance, or some comfort that they've done what is absolutely required, what's necessary. And then, as you may have stated already, the PMSAP program also contains a number of best practices. So a vendor organization understands not only what's necessary, but what is a good thing for them to be doing in developing and implementing their product. So they get that comfort level, so to speak, that they're doing the right thing. From the provider standpoint, again, an outside organization gives the provider some assurance that someone else has looked at this particular vendor. Someone else has said, you know, they are doing what's necessary, and even beyond that, they are doing what some of the best practices are. Gives the provider at least some additional assurance that when they deal with this vendor, they're getting a product that's sort of up to standards, and maybe even beyond. So we get assurance on both sides. I particularly like the emphasis on privacy and security, as that is becoming a bigger and bigger issue these days. And how is it that a provider can feel comfortable that they're getting a product that has the necessary privacy and security functionality built into it, if the provider takes advantage of it? Again, this gives some more assurance and comfort to a provider that they'll be able to protect their information at their site, and if they're dealing with a cloud-based vendor, that the vendor has the protections in place so that their information is safe.
Excellent. Thanks, Stanley. Appreciate it.
No problem.
Tim, let me go back to you for a second, and HATA's involvement. So, for organizations that are a number of the practice management system vendors that may be listening and part of the audience here, that perhaps aren't involved in HATA, and maybe as well interested in the PMSAP, the Practice Management System Accreditation Program, what kind of thoughts would you have for them on getting involved with HATA, as well as we've got a relationship obviously between EHNAC, WEDI, and HATA, and we're also looking, I think, to provide between our two organizations some additional incentives to the practice management vendors that are members of HATA as well. So maybe you want to spend a couple minutes to talk about kind of the value prop for organizations to get involved.
Excuse me. Thank you, Lee. I appreciate that. And you know, HATA, like I said, really saw the ROI in this, and we do promote the PMSAP as, or I should say, promote and support the PMSAP really as a benchmark of quality for PMS providers. So, you know, you can go to the HATA website, which is HATA, HATA-ASSN.org, HATA-ASSN.org. And there's information on the lower right-hand side about the PMSAP. And it goes to a page then that has a lot of the links that are on, takes you back basically directly to the EHNAC page. But one of the things why to get involved, well, there's two reasons really, is Lee is correct. There is a discount for HATA members to go through the PMSA project, accreditation program, I should say. And so that there's a financial incentive there. But also, as you've heard today, that there are HATA members already involved with this project. And it's you know, when you belong to an association, the nice thing about belonging to any association, and HATA in particular, is you can pick up the phone and you will be able to have that connection with Anna or Serene or Buddy and say, you know, I'm running into this problem. What did you do to solve that? So it's a support system. Plus, there's the support system of Ron Moser and at EHNAC and others at EHNAC that really help guide you through the process. So when you like when you join any organization, you don't have to go through it alone. And I think that's the real value proposition, plus the financial discount that you'll be getting as a HATA member.
Thanks, Tim. And we appreciate the partnership that we have with HATA and the ongoing relationship as we're going to continue to enhance the program. Ron, let me turn to you for 1 second. Many of the event practice management system vendors in the audience may be asking, well, you know, I've got a cloud-based platform that we're using. Can that also be part of the accreditation? Maybe you can spend a couple of minutes to talk about how organizations that do have a cloud environment, how we're reviewing those organizations.
Certainly. Thank you, Lee. One of the aspects I think I mentioned when I was talking earlier, we do look at not only the organization going through accreditation, but any outsourcers of theirs as well, which can include data centers, customer support organizations, etc. In other words, if you've outsourced something, that doesn't take it out of scope for our review. And we typically need to actually go on site if PHI is being handled by another organization. With cloud service providers, we are now working on programs for supporting, first of all, FedRAMP certified clouds, and eventually we'll be supporting other types of clouds, where we're looking at them more as a service provider, kind of separated from the data center because of the cloud-specific services for those who are starting to go after that. It would probably take me too long to go into all the details here, but it's something we're watching, and we actually have work groups in place that are putting together the requirements for that. Clouds, as we support them right now, do still require on-site visits. Again, unless you have a FedRAMP certified cloud, which certain government organizations can have. If you have that and you want to go after this accreditation, we are ready to start including organizations doing that, and eventually we'll be having support for other types of clouds as well. But certainly don't keep from contacting us with whatever type of data center or cloud technology we're using, and we can give you guidance on how we support that.
That's great. Thank you, and that's good advice, Ron. So let me ask a couple. First of all, do we have any questions that have come in, Ron?
Yes, let me.
If anybody does have any questions, please do.
Yes, Lee.
Yes.
Yes, I have a few here.
Okay.
One of them is they asked if we can speak to standards or what is being done for claims attachments, and I'll combine that with another question, which is ICD-10 must be supported, but also needs to still support ICD-9 because some payers are not going to ICD-10 yet. So claims attachments and support for ICD-9 and ICD-10, how have we addressed that?
Okay, so Ron, I didn't know if you want to initially answer that, and I'd like to get some input from Stanley and perhaps some others as well, but you might want to talk to some of the criteria and how we've incorporated some of that into the criteria.
Yeah, and I'll hit it high level, and Stanley will be able to address it even better than me, as he was a key subject matter expert on this. We do indeed address both of these, and we expect all of this to be supported. I think one of the tough things, it always seems to be the case, there are the laggards, right, with whether it's ICD-10 or way back when 4010, and what we require in terms of ongoing support. So Stanley, do you want to speak to some more of that?
Sure, and we do have criteria about the need to support ICD-9 and ICD-10 appropriately. There's certainly a recognition that even beyond October 1st, as providers have to deal with claims from prior to October 1st, ICD-9 will have to be supported. So we've got criteria on there for the appropriate support of ICD-9 and ICD-10. Claims attachment is a tougher one because today, as most folks know, there is no required standard for claims attachment. Each health plan or provider kind of chooses the way they want to send attachments, whether that's electronically, fax, or by mail. Because there isn't really a standard for doing that, there isn't a criteria that we can really use to show that a PMS is meeting any sort of a claims attachment standard. However, you can be assured that once a suggested standard, or excuse me, a standard is recommended and adopted, the criteria for claims attachments will be included in the accreditation program. But without a without a national standard or even a best practice that's around for claims attachments, it's tough to put a criteria in for that. I think one of the Lee, one of or Ron, one of the vendors might want to talk about their experience with claims attachments also.
Any of the Anna, Buddy, or Serene want to talk about that as well as what you're doing in your platforms as far as attachment?
From our side, we're prepared to utilize the claim attachment portion of the 837 to accommodate whatever document, whether it's a chart note, op note, or dictated report of some kind. But the standard says there's really not a standard yet, but the placement of a document, there's not really technology that challenging for us to accomplish. As it relates to ICD 9 and 10, we have to be compliant for both sides. So we're supporting now both, it have been since last year, a client using both 9 or 10. And if they go to 10, then the down code that will take, when a carrier doesn't take a 10, they'll do the down coding down to the respective 9s using this, kind of the standard gem file to make that happen.
Okay, good. Thanks, Buddy. Anna?
Yeah, I think the hard part with the attachment is even just the definition. Is it an image? Is it a progress note? Is it a CCD file? So because there isn't a standard, it makes it very difficult. We hear lots of options available, but no consensus on how to best do it, even from the payers. So what we're doing is, kind of availing ourselves of several options, depending on how the payer's requesting it. Yes, it can be linked to the 837, but again, without a clear direction on standards, it's very difficult to accomplish. Again, even just the definition of what is an attachment,
right?
Because it really could be anything.
Yep. Yeah, and Lee, if I can just add that we were very careful in prioritizing the criteria for the PMSAP and making sure that we had the right criteria for today's and in the very near future practice management systems, like requirements for ICD-10. In our discussions, we said that we don't want to overburden practice management systems and this whole program with too many criteria that are not in effect. So I think it's fair both to providers and the practice management systems to say we don't have a standard for attachments, but we'll be eyeing that very carefully and assure you that we'll add that criteria to the PMSAP when the attachment process is a little bit better standardized.
Great, thanks,
well, and I think that goes to the realistic accreditation, as opposed to having something that again is a little more disconnected. I think knowing that there's a process to review changes in regulations and in industry standards will help us kind of incorporate this in at the appropriate time.
Great. Serene, any additional thoughts?
I think, it's been pretty well covered. I think we're all sort of dealing with the same thing. You try to provide some options where the standards are not really existent around attachment. So I think we're all struggling there. And I see similarly we support IC9 and IC10, and our customers are testing both things because of the variations in what payers are going to accept when. So I think we're all in the same boat.
Sounds great. Thank you. Ron, let's go to the next question.
Okay, and I also want to emphasize any we don't cover here, we do have record of these questions and we will follow up even if you don't hear your answer here. I'll combine two again. One is from where can the criteria be downloaded, and the second is similar, and that is when the audio and video is available for this, where can that be obtained so that it can be viewed with friends and family with popcorn?
Okay, so we don't, unfortunately, we don't provide the popcorn, but you can download it at www.ehnac.org. We'll have probably within the next 3 days, we'll have the recording, and we'll also have the slides available from our website. So you'll be able to go onto that website, get the slides as well as the recording, and the criteria for the PMSAP is also downloadable. If you go to programs and click on PMSAP, you'll see the data sheet, which will give you an overview of the program, and right in it is the ability to download the criteria, so you can see all of the criteria as well. Okay, we'll also make it available. There may be others as well. WEDI may also have this available on their website, as well as MGMA. We'll make it available to all of the panelists, and hopefully they'll also have it available on their websites as well. All right. Other questions, Ron?
Yes, another question. I'm trying to understand this a little. I'll read it. I think another point, it says, I think another point for accreditation is that when a provider does an RFP to vendors, they can now remove the items that are a part of the accreditation and focus the request on the needs of the provider. I don't know if I fully understand that. Stanley, I don't know if that rings any bells with you.
Hey, Ron, I think what they're trying to say is this accreditation program takes care of a lot of factors that may have been listed separately in RFPs or RFIs, and that the provider, by saying we only want to look at accredited vendors, covers all those pieces so they don't have to list them separately, and they can focus their RFI on some of the necessary customizations for that particular provider.
I think and on that note, I think, Stanley, that was an excellent response. Ron, I think we're at close to the bottom of the hour, and I wanted to take, first of all, as Ron indicated, we will, if we have other questions, we will make sure and follow up with you on your questions. Second, I wanted to take the opportunity to thank all of you who, the audience who have participated and listened for the past hour and a half. We appreciate that, and we hopefully, if any of the vendors who are listening, hopefully that you've gotten a good perspective on what it takes to go through the process and got some good tips on what to do. And we're hoping that you will proceed to go through and make application to go through the accreditation program. I also wanted to thank the panel. I wanted to thank Ron Moser for not only helping to facilitate, but as well helping to moderate. And I wanted to thank Leanne Cardwell, the Senior Vice President of External Affairs for WEDI, Buddy Claiborne, President of Healthpac, Anna Croxton, Senior Vice President of NextGen, Tim McMullen, Executive Director for HATA, Serene Monroe from GE, Rob Tennant from MGMA, and Stanley Nachimson from Nachimson Advisors. I thank you all for all of your help and for really a terrific panel and webinar today.